As prescription drug costs continue to exponentially rise, many Americans feel overwhelmed and alone fighting for critical medications.
My name is Sarah Kapczynski.
Nate Mueller.
Darlene Holiday.
Darcy.
Todd Williams.
Elise Ryan.
Diana. Alexa Wilson.
Curtis Ford.
Julie Marsa.
Ryan Farmer.
I'm Corey Durbin, CEO of SHARx.
We live in the richest country in the world, and there's no reason that anybody should ever go without their medications just due to the cost of it. Unfortunately, that's kind of the world we live in today.
Your average American is having to make that choice sometimes between, paying bills and receiving medication that they really need.
Every day there's more and more people that get diagnosed with a disorder or disease or condition that they have to spend lots of money to get that medication.
Medications are expensive. Medications are unreasonably high nowadays, and they're just going to continue getting higher.
SHARx is a company that works to relieve that stress and fights for what is right. We're not just another option. We're the best solution for both employers and their employees, stabilizing costs and increasing access to life-saving and life-altering medications.
Seeing the cost that was padded in so many ways, from the manufacturer to the pharmacy to the clinic to administer a medication, was just astounding. And seeing what we can source it for and get it to members is just insane.
We're working a lot with the numbers and the reporting, so we get to see firsthand the amount of money that we are saving our members and our employers. It's real money that makes a difference, and to some people that could be an extra paycheck in a year that they're getting back just because we're able to help them source their medications.
Here in the United States, we have a broken system, and we're trying to champion that by helping this individual piece of working on reducing the worry, the burden, the cost, helping people with better ways to access their medication and be able to afford it.
SHARx is so important and critical, I think, for an employer who's trying to manage their plan and fiduciarily take care of the things that they need to take care of. The average person doesn't realize how out of control drug costs are because typically they haven't seen it. They've been shielded from that, from the plan. The employer, the insurance plan, pays the lion's share, and sometimes they pay all of it when somebody's hit their out-of-pocket max. That's why the educational part of what we do, our mission is to remove barriers to access and do it through world-class supply chain management, through procurement, and through education. Well, the education is really important right now because we pay 256% more for drugs than the rest of the world.
Redefining the healthcare space with our fiercely independent spirit, we're industry pioneers, always agile, team-oriented, and people-focused.
Not only do we have to work as a unit in order to get the job done, but we have to work as a unit with the group and the members as well in order to provide them the best services.
It's all about people. I love people, and SHARx loves people. So, when I found out that we were doing something to help out people and their medications, in my life I've gone through a lot. If I had SHARx in my life, it would have made it a lot easier.
It's knowing that we are ultimately making a difference. I think that we are really accomplishing great things and relieving stress for a lot of people, because a lot of these medicines, people will literally have to start questioning, am I gonna refinance my house or am I gonna get this medicine? You can't barter with the pharmacy. I'm really appreciative and grateful that I get to be part of a team that does make a difference. Small or big, still a difference.
The relationships that you create with these members and with these brokers, with these groups, goes a long way when you're talking about life-saving medications, because it's almost like a friend holding your hand, getting you the help that you need.
We are fearless problem solvers. When it comes to serving our members, we are relentless in exploring every sourcing option to deliver the world's best solutions for affordable healthcare.
Problem solving is fun. That's a hobby of mine, I guess. I don't know. I like digging into the challenges and just seeing what we can do. We don't always have the answers up front, and that's okay. Nobody has the answers up front. But really embracing the challenge and understanding that we're learning as the industry changes as well, and we're going to keep growing and changing. And there's a lot of positivity around that.
That's just what we are. We're very fearless in what we do, and we make sure that the problem or that the medication caused, which is the problem, is tackled.
The healthcare system is so complicated. A lot of times we run into things that we've never experienced before, and having to put our heads together and figure out how are we gonna work through this. We're not gonna let this keep us from getting this drug for this person.
There's not a, oops, we've hit a roadblock and we give up. It is, okay, what's the new solution? What's the way to get around this?
We get thrown so many different situations every day. With every year, there's different changes. There's changes with medication, with the medication industry.
SHARx is solving a problem that every single employer group has, and it's just the cost of medications. So really being able to, on a daily basis, work with employer groups, work with the brokers, and being able to offer that solution to their problem.
SHARx is fearless. There's not many people that would step in this arena, of medication and then hit it head on.
They don't have that burden, that worry is at least that piece of it is taken off their shoulders. And then we're able to give them a little bit of peace of mind.
Our strength lies in relationships. We guide our clients and members through a complex healthcare system with compassion and empathy, ensuring positive outcomes for everyone involved.
The experience for our team of seeing the impact that it has on the lives of the members that we service is absolutely one way, and the most important way. When we built SHARx, the most important thing to us in the beginning was the member experience. We built it around the concept of knowing this is just like we were treating one of our own, and as long as we do that consistently and make that the central focus, then everything else will fall into line for the employer too.
When adding SHARx to your company's health plan, you're choosing a partner in progress, where innovation meets compassion, and the result is a healthcare experience like no other.
SHARx stands for its members. SHARx really is looking out for those individuals that are having to make those tough choices, and that's both the employers and the employees. And I feel like SHARx can step in and really help alleviate some of that stress and alleviate some of those tough choices between, am I going to be able to continue to cover this employee's medications, or am I going to be able to keep my doors open?
What we value more than anything is not only affordable healthcare, but we value our members. We put our members before anything else. There's no reason that someone should have to decide between, do I pay for groceries this week, or do I pay for my medication, my child's medication, or whoever's medication that month. No one should ever, ever, ever have to make that decision.
We spoke with a gentleman who was on a heart medication, and even with his traditional insurance, was still in a position where he was taking half of his dosage that his doctor prescribed because he couldn't afford to go get a refill. And now enters SHARx, and now he's able to maintain that medication, and he has no worry of if he's going to be able to access that medication in the future.
With deep expertise, top industry talent, and cutting-edge technology, we don't just follow trends, we set them. At SHARx, our core values aren't just words, they're our driving force. Empathy, perseverance, adaptability, integrity, unity, focus, and rising to meet every challenge, elevating not only this industry, but each other as well.
Our vision really is just healthcare that works for everyone. To make it work for everyone, we have to be able to access medical care on a global basis. Our vision is to change the tide of what's gone on in this country and how out of whack the prices are because the unchecked nature of the free reign that Big Pharma has had in this country for too long.
SHARx, compassionate care, powerful procurement.